Muscle, muscles supplied by radial nerve. Radial nerve is the continuation of posterior cord of brachial plexus. It runs in radial groove in posterior aspect of humerus. Then it comes anteriorly in front of lateral epicondyle of humerus. It becomes a content of cubital fossa and give two terminal branches. Cutaneous branch to supply dorsum of lateral three and of fingers. Motor branch, also known as posterior interosseous nerve, to supply posterior forearm muscles. Muscles supplied by radial nerve. Triceps brachii muscle, anconeus muscle, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis. Muscle supplied by posterior interosseous nerve or pin. Motor branch of radial nerve. Extensors, abductor pollicis longus, injury of pin, difficulty in metacarpophalangeal joint extension, injury of radial nerve below radial groove. Extensor carpi radialis longus muscle is paralyzed, therefore difficulty in wrist extension, wrist drop, injury of radial nerve in axilla, seen in crutch palsy, paralysis of triceps muscle, therefore difficulty in elbow extension. Posterior forearm muscle, lateral group of superior extensors arising from lateral supracondylar line of humerus. Brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, supplied by main trunk of radial nerve. Posterior group of superficial extensors arising from lateral epicondyle of humerus. Extensor carpi ulnaris, extensor digiti minimi, extensor digitorum, supplied by posterior interosseous nerve. Muscles forming boundaries of anatomical snuff box. Abductor pollicis longus, extensor pollicis brevis, extensor pollicis longus. Important information: medial to Lister tubercle, extensor pollicis longus. Lateral to Lister tubercle, extensor pollicis brevis. Anatomical snuff box: anterolateral boundary, extensor pollicis brevis and abductor pollicis longus. Posteromedial boundary, anterior extensor pollicis longus. Dequervine tenosynovitis, anterolateral boundary of anatomical snuff box get inflamed. Extensor pollicis brevis and abductor pollicis longus muscles get inflamed in tenosynovitis. Finkelstein's test positive. Pain during ulnar deviation due to extensor pollicis brevis and adductor pollicis longus tendon inflammation. Content of anatomical snuff box: radial artery. Floor of anatomical snuff box: scaphoid bone, lower end of radial styloid bone, trapezius, base of first metacarpal. Fracture of scaphoid bone causes tenderness in anatomical snuff box. Roof of anatomical snuff box: superficial branch of radial nerve, supplies dorsum of hand. Cephalic vein, lateral continuation of dorsal venous arch of hand. Skin. Important information: pulse of radial artery can be felt in anatomical snuff box by pressing it against scaphoid bone and floor of anatomical snuff box. Comparative analysis of three main nerve injury. Hand of benediction is seen in median nerve injury. Claw hand is seen in ulnar nerve injury. Wrist drop is the case of radial nerve injury. Hand of benediction, median nerve injury. Claw hand, ulnar nerve injury. Wrist drop, radial nerve injury. Median nerve injury. Hand of benediction is seen with median nerve injury. Sensory loss in lateral 3.5 fingers including nail beds. Ask the patient to make a fist, but patient cannot make the fist. Lateral 3.5 fingers lag behind, unable to fold. This is due to compromise of flexor pollicis longus, thumb not able to fold. Flexor digitorum superficialis, flexor digitorum profundus, fingers not able to fold. Flexor pollicis longus, flexor digitorum superficialis, flexor digitorum profundus, supplied by anterior interosseous nerve, branch of median nerve. Flexor digitorum profundus is a hybrid muscle supplied by median nerve and ulnar nerve. Median nerve supplies lateral half of flexor digitorum profundus. Ulnar nerve supplies medial half of flexor digitorum profundus. Medial two fingers are able to fold in hand of benediction because flexor digitorum profundus part which is supplied by ulnar nerve. This is about median nerve injury. Main is hand of benediction. Hand of benediction.